Men's health is not just a topic, it is a vital narrative in the journey of well-being. In a world where the focus on health often tilts, we shine a spotlight on the unique challenges and considerations that shape men's wellness. From physical fitness to mental resilience, Dr. Emeziem is a distinguished medical practitioner at Monaghan Medical Clinic here in Halifax. He guides us through the nuances of holistic health. Thank you for joining us.
Thank you very much. Thank you for having me.
Right. So can you share some common health issues that men often overlook?
Well, it's good to be here, and it's good that we have a forum like this to talk about men's health. The things that worry us medics the most about men's health is that the ambivalence they show towards their health in particular. Oftentimes, men, especially men in our community, place wealth over health. Basically, they put other things and they put their healthcare in the back burner. So for that reason, simple things like hypertension,
Right.
diabetes, strokes, problems with cholesterol, prostate conditions, PSA being elevated, leading to, of course, things like prostate problems and many other things. The problem is that we do not pay attention to them, most especially mental health. Men oftentimes are not aware of the need to address these issues until it becomes a problem.
Right.
And so, like we said earlier on, men oftentimes are more reactive than proactive about it.
Yeah. The interesting thing here is you're not just a doctor. You're a man who probably understand how men feel.
Yeah.
As long as far as health is concerned. So kind of interested in knowing what are those preventive measures that men need to be able to take to heart in order to make sure that their mental health is in shape.
There are three things which I usually see that makes a man's mental health a big burden. The first thing that worries a man is problem that has to do with his finances. Okay?
Right.
Financial issues sometimes places burdens on men. Also, issues like work pressure also impacts on men's mental health. And also, lastly, family issues as well as their own physical health.
Right.
Unfortunately, men have a condition we call alexithymia. Basically, they don't pay attention to what's going on.
Right.
In their own, they are not mentally aware. That awareness which you find in the women, is missing in men. So, because of our ego, we try to push everything back and feel that we can handle it ourselves. Yeah. And for that reason, we are sinking further and further. Most time, by the time men ask for help, it's often when things are really bad, and this is why the suicidal rate in men is higher than in women.
Are there specific challenges? Let's come to your community now. Specific health challenges that you think people within your community are facing, men in this case, and how can they best address those challenges?
That's a very good question, because I see this all the time when I get new patients coming to register with me for the first time. And the first thing is, oh, my wife made me come here because I really don't know why I need a doctor. Right. And then when we look at their blood pressure, they are reading very, very high blood pressure. And they say, oh, when was the last time you checked your blood pressure? Doctor, it's been a while. I can't remember. Really? Yeah, and because things like hypertension is something that does not really give you any sign. You might be carrying for such a long time. Yeah. And you will not know until there's a causing problem with your eye, with your kidney, with the brain, with the heart. So that's one big thing. Another issue which I see quite commonly is the problem with cholesterol. Oftentimes, when you do blood work afterwards, you find out, oh my goodness, your lipids are so high, your cholesterol level is high, and because they've never had health checks in a long time, they don't know they're carrying such a high level of cholesterol, and what really leads to this oftentimes is because of our diet.
Our diet.
Yes.
Now, talking about diet, and it has become a tradition. Whenever you are talking about well-being, wellness, diet is always there, forefront, and then exercise. What role does it actually play in promoting wellness or good health?
That can never be overemphasized. Because you see, you are what you eat.
Okay.
Okay. And until we realize the effect of diet in our lifestyle, we'll never take it seriously.
Right.
I have found that diet will affect your mental health.
Yeah.
It will affect your physical health, and it also affect how you carry yourself as a person. So if we do not pay adequate attention to our diet, our health will keep going down the drain. I'll give you a simple example. There's a device called there are different devices called glucose monitoring system, and basically we don't use it for everybody. We use it for men or women that have diabetes.
Okay.
To check their blood sugar.
Yeah.
All right. And oftentimes I find that in our community, diabetes is quite common. Okay. And this is again diet related. All right. So I give them a prescription for this device. Stick this on. All right. Because what this device does, you apply it to your arm. All right. And then it's connected to your phone like an app. So it's reading your blood sugar all the time. As you go. Right. You don't need to tap it. It's just reading your blood sugar every moment. And then what happens is, for those patients that have given this thing, they find that when they eat white bread, they eat white rice, they eat our swallow, carbohydrate-rich food, things like that, they see how their sugar spikes up.
Oh.
It goes very, very high. And they are alarmed. They say, oh my goodness, how come I eat A, my sugar just goes up a little bit. But when I eat just a small quantity of this, it spikes up. And because we don't know, the body doesn't tell you your sugar is going up. You eat all those things that make your sugar goes up all the time. At some point, your body will not be able to cope with that, and you end up with diabetes.
Yeah. You talked about, when people take different things, they tend to see different results.
Yep.
And one will be curious to know, what are those early signs that men need to look out as far as their health is concerned, and how can they stay in touch and to ensure that they don't break down health-wise?
Okay, I think first of all, men have to pay attention to their mental health. Okay, I find that in our community especially, men are rather oblivious of their mental health, and which oftentimes because of the sacrificial nature men have, they put their families first.
That's right.
So they work so hard and they work themselves to the grind.
Yeah.
And so they need to be aware that, if I need a break, I need to slow down.
Yeah.
That's the first thing, mental health.
Yeah.
The next thing is making sure that they've got time to smile. They've got time to spend with your family.
Yeah.
It's not about working 24 hours round the clock trying to make money for your family.
Yeah.
Enjoy your children, enjoy your wife.
Yeah.
Make time out
to
relax. Make time out for holidays.
Yeah.
Engage in physical activities 5 times a week. Engage in physical activity like exercise. 30 minutes. Go kick the ball around with your kids.
Yeah.
Go run. Go for a walk with your kids, with your wife. You know, spend some time. And that takes me back to that same device I was telling you about.
Yeah.
So for those population of patients that have given this, they realize that when they've done simple activity for 30 minutes, their sugar just drops down. Whoa.
Oh.
Real quick. And you do not know that until you see it, because unfortunately, our body is the perfect machine, but we don't have a meter that tells us anything until we're breaking down.
That's right.
That's only when we realize it.
Yeah. You see, mental health, as much as I've spoken to many people who are of your community, they seem to see mental health to be a myth. Oh, it doesn't happen in Africa and some other places they come from. Yeah. And so they say mental health, it's only when people are on the streets, stripped naked, and they are just running around like crazy people. So what would you be saying to them? And how can they watch out to probably measure within themselves to say, I think I need to check on my mental health? What are those things they need to be doing?
I think first of all, we have to remove the stigmatization we have towards mental health and mental health related problems in our community.
Okay.
And this is why when people have problems, especially men, they don't call for help.
Yeah.
Okay, so first of all, the stigmatization has to be removed from the system.
That's right.
And once we can get rid of that, we can now start talking about those simple things that, we think it's part of being a man. If you live in Lagos, for example, I think everybody in Lagos have mental health problems.
Okay.
Because the stress
Lagos, you mean Nigeria, right?
Lagos, Nigeria,
Okay.
yes. Because you see, our baseline is the stress.
Right.
Our baseline for us is stress. We don't know when to relax. We don't know how to. Everybody's shouting and blaring and fighting the next person. So we think this is the norm, okay? And we think that mental health is only, like you said, when people are like they've gone to that's extreme mental health problem. Yeah. But anxiety, depression, these are big things which we need to be able to talk about openly and being honest with one another.
Yeah, and so you're talking about people being open, talking about it. And of course, the downside is some of the stigmatization that a lot of people have faced. But let's talk about communities right now. How can they support and encourage, a healthy living, people who are within that space, near to breaking down health-wise, mentally, and so on? What should the communities be thinking? How can they approach people who have found themselves in this unfortunate situation?
I think the first thing is exactly what we're doing here.
Okay.
Having an open conversation about these things, being able to talk about it and taking away the stigmatization about it. Yeah. And also being our neighbors' helper, but our neighbors' keepers. Yeah. Okay. We're able to say to one another, okay, listen, I think you need to slow down. I can help you. Oh, you have a problem with child health or with child care? Let me help you. We need to work together as communities. And when we're able to talk to one another, we're able to interact and support one another, then of course, that is the beginning of dealing with mental health problems. Yeah. And also, when you notice that there's something wrong, I think we should be able to say, I think you should be speaking to your doctor. Yeah. And that is very important. Yeah. Because many times people carry these things, it ends up becoming physical problems. Yeah. Hypertension and other things.
I hear you. If you want to describe the country, Canada, as an individual, you realize that Canada itself is having high blood pressure. You're having mental issues because of the crisis we found ourselves, economic crisis, health issues, housing issues, and all that. So, but we still find people who are struggling to strike a balance. They want to be able to provide for their families. They want to be able to pick up their bills. What will you be telling them? Work a little more or work less? What should be their priority in this case?
That's a difficult question because you have to look at reality and theory. Right. So it's easy for you to say, work less, take life easy, but you've got bills to pay.
That's right.
And those bills are not waiting for you. So how do you strike a balance? I think the first thing is putting your health before your wealth. Okay? That's right. And the way we can do that, first of all, is to actually do an internal audit on what are the things in my life that I can do away with that brings me stress. And what are the things I can do better? Because you see, nobody wants to work more and earn less. You have to work smart. Yeah. We all have to learn how to start working smart. Yeah. So that we put in the right amount of effort and get the maximum outcome.
That's right.
Okay. And that's how we should get this going. Right. So how can we do that? Look at your job. Do an internal, is this job the right job for me? Do I have to work 8 hours there, 4 hours there, 6 hours there to make ends meet? You don't need to do that. No. Okay. If it means taking a lacuna for 6 to 3 or 6 to 12 months to study something you really enjoy doing, because when you work in an area you enjoy, it's not going to be work for you anymore. That's right. It's going to be a hobby. You're going to enjoy doing it. So it takes away that stress away from your life. Okay. Yeah. The next thing you want to do, there's room for collaboration.
That's right.
Okay. So if you are lucky to be in a relationship, married or in partnership with somebody, share the burden. Yeah. Do not just allow one person carry the burden, because where one person carries the burden, it creates a lot of health problems and misunderstanding. amongst that relationship. We want to be able to, I mean, not everybody can carry the same amount of load. Some people have to do the heavy lifting, others can do the light lifting, but there should be collaboration between partners and speak to one another.
Very
important.
Yeah, prior to our interview, you talked about lifestyle, how the role it plays in ensuring people, are staying well, and their mental health is put in check. But as we wrap up, I believe that there are resources out there that people can leverage to learn more about how to stay in shape, health-wise and otherwise. What are those resources here in Halifax, for instance?
Honestly, there are so many of them. Okay, so if you go to places like Canada Game Center or the local health shops around the
resource centers,
there are so many resources there that you can reach out to. Also, there's in Nova Scotia generally. We've got the CMHT, that's the Community Mental Health Team, and also they also provide well-being for people. They give you advice on physical activities. They give you advice on diet. They give you advice. They're like navigators. Okay, so they can just navigate. So without paying a dime, you can get this help, and I can provide that to the community update team later on, where they can just go to them, speak to them about things you need, and you don't have to pay anything. They will navigate you and direct you on the right places to get the right type of help. And honestly, every one of us should try. I'm a doctor, so it's hard for me to do this sometimes, but I have to push myself. Taking time to walk for 30 minutes, at least 5 times a day. And the reason I love my job is I work in a clinic where I've got 2 offices, and every day by moving from one end to the other, standing up, I actually put in about 45 minutes of walk every day. I do almost 8,000 to 10,000 steps at work.
Some calories are burned.
Exactly.
At work, right?
Exactly. And, so we should do that. And, these days there are also wrist devices that people can have that can monitor how much physical activity you're doing each day. It helps you to keep up. There are days on the weekend when I'm not doing so much. I find that I've not closed my rings. I jump out, I do some work until I make sure I close my rings. Everybody should try their best to give yourself a goal, give yourself a target, try to get involved in physical activity. It will make a huge difference.
It will go a long way, and I believe a lot of people have some benefits, some health benefits, like gym membership, employment, that they are not leveraging. Right? I feel it's time that people will begin to do that audit internally and say, but I'm going to give you the chance to say one more thing before we wrap up, and this is festive period. People take a lot beverage, they eat a lot of food, they do less exercise, they stay at home, they watch movie. What will you be telling them?
Promise, you said it all. You should be a doctor. This is festive season. Listen, there's nothing as good as spending time with family. That's what this period is all about, being festive. But my belief is this: there should be moderation.
That's right.
In everything we're doing, whether we are having a drink, we are eating something, or we are just having fun, there should be moderation. The problem is, unfortunately, some people don't know the limit where to stop when it comes to alcohol. Some people don't know the when it comes to food. They stop themselves silly until they are knocked out before they know they need to stop.
No, we don't need that.
We don't need that. There must be moderation in everything we're doing. And if we can all live moderate lives, the world will be a better place.
Beautiful place. There could have been a better place to live it. Live moderate, and the world will be a better place for us.
Absolutely.
Thank you so much, Doctor, for coming to the show. Really appreciate your time and providing us insight to how to live healthy.
All right.
All right. Unfortunately, that is all the time we have. I have been talking to Dr. Alex Emeziem, a medical practitioner at Monaghan Medical Clinic here in Halifax. Make sure to subscribe to this channel for more updates. You can also reach out to us by sending us an email to communityupdateNS@gmail.com. I am Promise Okoy, and I will see you soon.
Community Update is brought to you with the support of the following organizations, businesses and individuals: Heritage Canada, Canadian Association of Community Television Users and Stations, Cactus, Bailey O, M4 Media, and Shokoto.